Our second speaker is Marisa Merino from OSAKIDETZA, from the Basque Public Health Service, and she will talk about integrative care as a response to the challenges. And my name is Marisa Merino, and I'm from the Integrative Care Organization of Tolosaldea. Rosa has made a fantastic introduction so that you have a very good context. Our organization is part of OSAKIDETZA, is one of the 3 organizations. It's 20-minute drive from San Sebastian, from Donosti. And we are OSI since 2015. Aging, chronicity increase, make health services to look for new strategies to improve care. And in that aim, OSAKIDETZA in 2013 organized to create integrated health services, and in order to improve care for our patients. Ever since the IHS were kicked in, we started to work on a framework agreement, and that has set the guides. So it's a populational-based approach, and with a very specific governance approach. And the idea is, by combining the cultural change and a governance model, we want to have an integrated care productive interactions. So we have an annual program that is updated on a yearly basis, and that we use as a reference. All these, we all use the same agreement, the same framework agreement. So what did we do in our organization? We came to life in 2015, and we started to work with this framework. The idea was to improve integrated care of our population. We cover 66,000 people, which belong to 33 municipalities, and our aim was to have put the patient at the center, and to focus on primary care, and to get involved with all the stakeholders, and using an advanced management model. And that so the first thing we did, we identified the different stakeholders in our organization, and we built the strategic program with them. We set up groups, we involved them all, and we defined the mission: contribute to improve health in our population in an efficient, innovative, and safe manner, to the benefit of society. Our values are patient, professionalism, teamwork, a sense of belonging, participation, which is key, and good governance. And by using an advanced management model, because we were using very similar models in the past. So, which is, we have an integrated management model, which is based on an advanced management model, like everywhere in OSAKIDETZA. We have 5 elements. Strategy. Strategy is very important to have contact with the stakeholders, and based on the initiatives of the stakeholders, we develop a strategic plan, and we deployed this or implemented this in the process. Customers, and we want a cross-sectional and longitudinal care, and promoting and health. With regards to professionals, we have a distributed leadership model. With regards to primary care services, these are distributed in order to favor communication. We wanted to have this distributed model. And then we have talent management. With regards to the social aspect, OSAKIDETZA is the biggest company in the Basque country, so we are the main driver of local economies. We need to favor this element, and it's very important. Transparency is very important, as well as sustainability. And then innovation. Innovation is fundamental. If we are to move forward, innovation plays a key role. Not only innovation as such, but we need to manage innovation and use the tools offered by technologies. We foster artificial intelligence projects that allow us to go to 5P, preventive, predictive, population-based, and we integrate resources or requests from other elements like certifications, ISOs, etc. The strategic approach, like any other organization, we are based on the health plan, and from there we build up the strategic lines, and we have the agreement on a yearly basis that sets the guides together with our strategic plan that we have drafted. So with this, we put this together and we have a strategic plan, and we disseminate this information to different areas and different services, and we have indicators as well. With regards to outcomes, we have an assessment of the framework agreement or framework program that has 9 pillars with over 200 indicators at all levels. Apart from approach and deployment and midterm indicators and outcomes, within the these OSIS ranks, we are top performers. We started in 2015, but we've always had the best performance. Something else that was mentioned by Rosa was the survey on the perception of patients on integrated care. Colors represent our organization, and we already started off very well because in that area we had been working as in this field before becoming an integrated care service, but we're always above the OSAKIDETZA average. So this approach has allowed us to get very good outcomes, not only in terms of the contract, but in terms of other certifications. We have the quality certification, the OSHA's certificates, the RSCs, and we have a number of certificates. Now we are managing or applying for the innovation management certification, and this has allowed us to get certain recognitions, like for example the award for integrated care, the advanced management model Euskalit Silver, the the best project of digital health, the Health 2.0 past 2018, or the Quality Innovation Award that we won in Beijing. And then I would like to talk about the CareWell European project that was led from OSAKIDETZA, and we are mainly involved in all the project. I was the lead investigator. We received many awards at national and international level. The prize, the Elicit prize, we won the Elicit prize in Dublin. With this project, the European Commission published the fact that out of all the projects carried out over the past 11 years, CareWell was the top projects, because it was a multiple pathology integrated care project, and we are fully involved in this project. With regards to the approach and the management model, an integrated care service and combined with a good management model is worth it. It improves healthcare, it improves satisfaction of professionals and patients, as well as the sustainability of the healthcare system. The involvement of all stakeholders right from the beginning and assessing and validating the progress does have an impact on outcomes. And this is something that we should consider in the future. Leadership, clinical leadership and professional leadership is fundamental to implement these sort of models, and that we need, especially managers and area leaders, we need to have tools, we need to have knowledge that help us facilitate and make this work and to reach our goals in order to get to the integrated care. I did want to show you a video of our organization for you to watch.
Sí, sí. La Organización Sanitaria Integrada Tolosaldea está formada.
The integrated healthcare is made up of 5 primary care services and provides service to 66,000 users. We want to contribute to improve people's health in a safe, innovative, efficient manner. For this purpose, we are committed to integrated care, where the patient is at the center. We have 186 professionals. We integrate values like patient at the center, professionalism, teamwork, sense of belonging, participation, and good governance. In our management system, we promote continuous improvement in the advanced management model based on the strategies developed by the stakeholders. We develop the strategic plan that is developed depending on the process. Our target are customers that are stratified depending on the population. We work with outside partners to provide integrated, continuous and longitudinal care. We perform actions to promote health, and we have communication channels to manage our relationship with our customers. We share leadership. This commit our professionals. We take care of the healthcare of our professionals, and we manage talent. And we also ensure the rights, the language rights of the people. We are fully committed with the environmental and social sustainability, and we are committed with the ethics and transparency. We are one of the main drivers of local economy. Innovation helps us face current and future challenges. We would like to highlight the fact that we have participated at different European projects, and we have disseminated knowledge, and we have participated in digital health. The idea is to help professionals in the decision-making process. This has allowed us to achieve excellent outcomes, awards and certifications in safety, health and safety, and quality, social responsibility, environmental management, data protection, and smoke-free atmosphere or environment. We work for your health. Thank you very much. Questions? I'm going to check Slido, see if anyone... I have a question about digital transformation. That's one of the awards that you obtained, and congratulations for all your awards. What did you do in terms of digital transformation, and what did you do in that digital transformation? Well, we prioritize projects that use technologies that make our life easier, projects that lead to improved satisfaction of professionals and patients. The CareWell project, in all steps, we looked at the journey of the patient. We looked at the players which interacted with the patient, and we looked at which technologies could allow for better communication between the patients and professionals. And we considered this, and the award that we received in Beijing last month is because we developed a diabetes retinopathy screening software in order to improve patient care and the efficiency of our services. And now we are developing digital skills set for primary care professionals. The idea is to improve their knowledge and to improve and to direct training to these professionals so that they can develop further. Because right now there's a sustainability issue. And if we apply new technologies well, and if these are shown to be efficient, then I think that this is going to help us to be more sustainable. But we need to be rigorous, and by conducting an assessment within our philosophy, we want to work along those lines so that people can benefit from the good things of digital transformation, because whether we like it or not, there's the way forward. Thank you very much. Microphone, please. Hello, my name is Maider Mateos. Rosa knows me already. Marisa, I met her over the phone last week, but this question is for both. Integrated has been assessed in many parts, and you looked at people satisfaction, you looked at professional satisfaction, and you've mentioned some indicators. I don't know which indicators exactly, but what I was missing, and then this is my question, whether you've done this or not, or whether there are plans to do this. The aim of integration is to contribute to improve people's health. But have you measured that improvement of health? Have you been reduced of adverse events or admissions, or that you see that people have better health, or they monitor their pathology or through COPD, whether there's more health indicator that allows you to know whether there has a positive impact? Well, when I talked about the integrated healthcare framework, there's 9 pillars, but there are 9 dimensions, but over 200 indicators. And part of these indicators looks at how you deploy this. But I think there are 24 out of 100 depend on this. 64 would be what you are referring, and then there's another percentage that is for projects that could depend on organizations. We all share the same indicators. Most of the indicators are related to health outcomes. So historically, organizations always measure intermediary results or outcome, and these sort of assessments allows you to see the progress, but it also looks at final results. And we all measure the same things, and this allows us to compare among ourselves. I've given you the global ranking, but within the unit or within the health center, you know that if you're not performing well on a specific area, you know who's performing well, and that you can learn from these other people who are performing better, and or you can resort to other regions or other countries. So we are, compared to other regions, we can say that we are better because you measure and you compare yourself. So all these indicators and is transferred to the centers every 4 months. We meet with other primary care centers and we go indicator by indicator, and you go one by one, and depending on how you're performing, you have different improvement plans. improvement plans that are suggested by different organizations, because these are the people who work with the patient. So we not only have the disease type indicators, but we have community health indicators in order to promote health. So that's the way forward. In the integrated health framework, we look at the health outcomes. Last year, together with Deusto, we put up a framework. It's called the MORE tool. It's a web-based tool that way you can assess. And we validated this. And basically, it's a self-assessment whereby it allows you to know whether you are health orientated or not. And when we did this self-assessment, we achieved a very good outcome. You always get things where you can improve, and this year we will see, whenever we do this self-assessment, we've done the things that we wanted. But just to confirm that, and this framework was not with OSAKIDETZA but with other players. So we thought that the framework in OSAKIDETZA was orientated to health, and the framework in OSAKIDETZA is very much geared towards health outcomes. The framework contract includes a number of indicators for certain pathologies, and there are OSAKIDETZA organizations that work with ICHOL. ICHOL has a number of health outcome indicators and patient experience indicators. Are these sufficient? Well, I believe not. I think that we ought to work more with health outcomes, and we have a project to try and continue working more with health outcome-based indicators, and it's a challenge. There's no doubt about that. It not only affects our region or our organization. I think that this is the case in many regions, and like the many organizations are working in terms of transparency. It's a challenge at a European level. So we need to get away from structure indicators or process indicators that have worked very well, but we need to focus more on health outcomes. And I agree with Rosa. We need to work on patient experience. We are working with the ESPAC, but we are working with other things in OSAKIDETZA. We have a high satisfaction rate of the patients, and 99.25% out of 100 were very good, but we will be victims of our success. So we have started out to set up patients fora where we ask them what we ask patients to express what we can do. We've done a group with retired people, and they're very happy, and they asked us to do this in other age ranges, and they surprised us the fact that they like technologies, that elder people like to follow with phone calls. They want to use Skype because they want to see the doctor when they do these online consultations, and we received a great deal of information from them. So we are working very well, but we need to continue. In terms of quality of life, we have surveys and questionnaires on the website, and there are certain in certain processes and certain pathologies, things are being done. We need to continue working. We need to integrate it in one way or another. and we need to work with health-based outcomes. That's no doubt about it. Questions? Any? Okay, we got to the end. If not, we can always continue our discussion later. There are going to be many opportunities to meet. I would like to thank Rosa and Marisa, and I hope that you enjoy the rest of the conference, and I hope to see you again. All the presentations and the video will be available at the ICIC website. Thank you very much.